slides that I'm going to present have some information that's a bit redundant to what Dave just presented, but really to put in a context of what a big deal, what a big change health reform needs in states, not just here in the Northeast, but really across the country. So for me to make some points and to remind us that so much has happened in the first 3 years of implementation. 2014 has always been a milestone year that ever since the law was passed in 2010, everyone's looked forward to, that, oh, the law is going to be in effect in 2014. And by way of illustrations, just some reminders of how much has happened and how many lives have really been changed and saved in the meantime. And another part of how much has happened is the advocacy and the leadership shown by the legislators who are here today. And I appreciate those that have already been recognized and thank them. And I also want to recognize Dorothy Grady is here from Congressman Joe Portney's office. And we are fortunate to have very strong delegations in the Northeast as well, who are very strong partners as we move forward with implementation. So just to remind, and this is the eastern states, which of course are part of today's CSG program, just to show you the structure of the U.S. Department of Health and Human Services into 10 regions, divides the country into 10 regions. We are Connecticut in Region 1. I serve as Secretary Kathleen Sebelius' representative to the 6 New England states. New York, New Jersey, Puerto Rico, Virgin Islands are part of Region 2 of the Department of Health and Human Services. And then you'll see the Mid-Atlantic states in Region 3. So here in New England, a region that includes so many dynamic states who really have, as I said, been on the forefront of the state health reform, and an exciting place at an exciting time to be working in partnership with them. And then just very quickly, some major themes of the Affordable Care Act. So in addition to new consumer protections for health insurance and choice for consumers in health insurance, an unprecedented investment in prevention and public health and the principles of public health, improving the quality of care and investing in the innovation and the delivery of that care, making health care more affordable, and that's not just in reducing out-of-pocket costs for individuals, some examples of which Dave just explained, but also reducing overall system costs through efficiency and more value than volume emphasis, and then of course expanding coverage, for which the exchanges are a major foundation and vehicle. I list here preventive services under the Affordable Care Act. There has been a lot of discussion and a lot of publicity about the preventive services that are a new historic benefit included in the Medicare program under the Affordable Care Act. But it's often underappreciated that preventive services are now required, a range of preventive services required for no out-of-pocket costs for new private health insurance products as well. And here we know that just in the past 2 years, 71 million people in the country have received at least one preventive service benefit with no out-of-pocket costs. Nearly 1 million in Connecticut, and that's privately insured. Those are the privately insured. And just, you know, very quickly, this was, again, one of the early benefits of the Affordable Care Act for new and renewing policies after the law was passed in March of 2010. And I'll tell you very quickly, it's become a benefit that has been so long-standing that some people forget that it's a benefit that's provided by the Affordable Care Act. And quickly, I'll tell you, I was in the parents' room of my daughter's, then 4-year-old daughter's ballet class. And one of the mothers was talking to the other mother about how she had just brought Sally to get her annual vaccination and got a reimbursement check from her insurance company because she doesn't have to pay the copay anymore. And I thought, she doesn't even know that's because of the Affordable Care Act. So I kind of poked my head up out of my book, my Saturday morning book, and said, that's because of the federal health reform law, you know, which was met with some curious look about what is this federal health reform law you're talking about. And that was more than a couple of years ago. There's a lot for all of us to know now. And then the essential health benefits, which Dave ran through, and I've highlighted actually myself some key to note. And as Dave also noted, maternity and newborn care, mental health and substance use disorder services, preventive and wellness services, chronic disease management, which we know is such a worthwhile investment. And for the first time, pediatric dental and vision benefits will be required in insurance policies sold in every state. And the final rule on essential benefits, in fact, was published just on February 20th. This spring in 2013, in fact, is marked by a lot of rules being finalized as we prepare for the exchanges to be, and the new health insurance marketplaces to be running in all states by the end of this year. And then investing in innovation, improving care, and saving money. So another strong theme of the Affordable Care Act. And the Innovation Center created within HHS's Center for Medicare and Medicaid Services, and it is an example of that. And in Connecticut, in fact, where we are, much grant funding has flowed to providers and to their partners in improving the quality of care and the delivery of care. State Innovation Model just a few weeks ago was announced $2 million to the state of Connecticut for a model design initiative. Healthcare Innovation Awards, a asthma prevention effort throughout New England, including Connecticut, received a grant from the Innovation Center. Accountable care organizations, the new realignment of providers to improve outcomes for patients and improve quality. And then the Partnership for Patients, which seeks to reduce hospital-acquired infections and to improve transitions of care from inpatient to outpatient settings. Where just here in Connecticut, there are 84 partner organizations, providers, consumer organizations, and others who have signed the pledge for Partnership for Patients. Much of which, in the Innovation Center, by the way, is really based on new uses and stronger presence of health information technology. And again, when my then 3-year-old came home from her well child visit at the pediatrician and played doctor with her toy laptop, I knew the future of health technology was here. That is the experience now for the patient. So again, under making healthcare more affordable, and I mentioned some of the historic changes in the Medicare program. So no more cost sharing for a range of preventive services that are covered under Medicare, including a free, for the first time in the history of the Medicare program, annual wellness visit, which is a particular opportunity to sit with one's provider to talk about some wellness opportunities. And then closing the Medicare D donut hole. We have had the opportunity to work with seniors and to hear from them how much savings are potential here. And in 2012 alone in Connecticut, I'll give you an example, 340,000 Medicare beneficiaries accessed a preventive service that was covered. That's about 1.5 million throughout New England. And since 2010, over $78 million in prescription drug costs have been saved by seniors. And in 2012, more than 47,000 seniors in New England, in Connecticut, by the way, saved an average of more than $690, more like $800. So significant savings to Medicare beneficiaries, individual out-of-pocket costs. And then I mentioned, we're just about on the 3-year anniversary of the passage of the Affordable Care Act. So a year ago, at this time, we spent a lot of time with individuals and small business owners and others who benefited from the Affordable Care Act and who were willing to share their stories publicly with us at the department. This happened to be in Manchester, New Hampshire. And it was 1 year ago, almost to the day, in March of 2012, when some were looking forward to the Supreme Court issuing its decision on the Affordable Care Act, we said meet these people. So these women, Nancy Clark on the end, talking about the small business she owns in rural New Hampshire and reusing paper clips and turning off the heat and lights when her last employee would leave for the day so that she could preserve her investment that she contributed to their health insurance premiums, received a small business health insurance tax credit thanks to the Affordable Care Act of about $2,000, and it made all the difference for her to be able to maintain that commitment for her workers. Also at the table, Gail, who was able to enroll in the pre-existing condition insurance plan, which was a bridge to 2014, when there will no longer be exclusions for pre-existing conditions permitted in any state. Gail told us about her planning the meeting with her doctor to talk about when it would be time for her to sell her house to continue her cancer treatments. She was able to enroll in the pre-existing condition insurance program. She was the first one to enroll in the state of New Hampshire, and it not only changed, but she talks about it saving her life. And then the inset is Teresa, whom I met in Portland, Maine that very same week, who told the story of her husband Rocky, who was diagnosed with cancer in early 2010, very quickly hit the lifetime limit on his health insurance, and then very quickly after that they were more than $2 million in personal medical debt. And her husband Rocky died the day before the Affordable Care Act was passed in March of 2010, when he would have been protected from that lifetime limit on his health insurance plan. And in fact, 1 million people in Connecticut have been protected already. So just a snippet from the implementation timeline, which is actually on our website, which is a main portal for information about the Affordable Care Act, healthcare.gov, just to highlight that, you know, what's not on that slide is 2010, 2011, 2012. A lot has happened already. We're now looking forward to, through 2013, to the establishment of the health insurance marketplace at January 1, 2014. And as you heard, the health insurance marketplaces are competitive marketplaces in each state, providing affordable options for individuals and small businesses. Operational in each state, January 1, 2014. And in New England, you also saw that, this is I like Dave's map better, but this is the chart of the conditionally approved marketplaces in each state. So the highlighted are the 6 New England states, and 4 state-based insurance marketplaces in New England: Massachusetts, Connecticut, Rhode Island, Vermont. 1 federally facilitated marketplace will be in Maine, and then New Hampshire has been conditionally approved to operate a partnership marketplace in which the state will assume the plan management, plan certification functions, and the federal government, the Department of Health and Human Services, will partner with folks up there on consumer outreach and enrollment. And some key dates for the marketplaces in 2013. Many rules being finalized in February of 2013, and actually, in fact, into March. And as I mentioned, a very fast series of rules being proposed and rules being finalized, including final rules published February 20th on the essential health benefits I mentioned. Insurance market reforms, final rules were published on February 22nd. Final rules on risk adjustment, reinsurance, and advanced payments of the premium tax credit were published on March 1st. And we have some proposed rules that are out for comment now, including a recommended preventive services policy, for which comments are due April 8th, and the special enrollment periods and transitional policy for the state, the Small Business Health Options program. The comments are due April 1st. And all of these proposed rules are on healthcare.gov, and you can also see that the CMS website as well will have information on those. So a lot going on, and in 2013, again, you can see as the key dates, really brings us ramping up into training for consumer assistance, marketing to potential consumers. That is going to, those functions really are where the Department of Health and Human Services is going to work in the states with federally facilitated marketplaces. And of course, in Connecticut and the other 3 states in New England with state-based exchanges that have funding from the department to perform that here. Connecticut, as well as the other states in New England, really benefit from a robust infrastructure and a long history of partnerships, private and public partnerships, which will serve that process very well. Just another version of the timeline. It's really all about customer service and building the marketplaces in each state. Looking forward to enrollment opening in October. So more information about the Affordable Care Act, as I mentioned, healthcare.gov is a very good portal for information. The department, it links to proposed rules, final rules, language of the Affordable Care Act. It actually was relaunched February 1st to really focus from its homepage on consumers and enabling consumers to find information about insurance options state by state, for example. Health insurance marketplace it refers to those states in which a federally facilitated marketplace will operate, and that's the branding for that. The website for that has been created, marketplace.cms.gov, and then Access Health Connecticut is an example of a state-based exchange, which is, of course, your health insurance marketplace here in Connecticut. And then just a final word from the Secretary. Our goal is, after all, the goal that we share for all Americans to live healthier, more prosperous, and more productive lives. And really, at the end of the day, this is what all of this partnership is about. And there's just finally some contact information. On those rare days I am not out in a state in New England, I sit in the headquarters of the regional office in Boston. And there's my contact